all the politicking going on in Iowa, one of the most important issues on the table is getting little attention. Senior citizens in Iowa and all around the country are being bombarded with pitches for something called Medicare Advantage. Now, this is a privately run, controversial alternative to traditional Medicare. It promises big savings and better benefits, but there are serious concerns, which we learned through one woman's experience in our latest installment of GMA Gets Answers.
I don't like staying in the bed.
For a fiercely independent woman like 77-year-old Angela Dispenza, being stuck here is unbearable.
I don't want to be here. I got a house to take care of, bills.
But over the summer, this usually active widow from Queens, New York, slipped and fell. Instead of tending her garden or walking to Mass, Angela lay in bed, writhing in pain. She was rushed to the emergency room at Jamaica Hospital.
She had a fracture in her back.
Broken back?
Yes.
No question.
No question.
But when hospital staff asked Angela's insurance company, Oxford, to admit her, the company said no. Did you tell the woman from the HMO that she had a broken back?
Yes.
And what was their response?
That she's not for admission, that she did not need to be in the hospital.
Usually when seniors visit a hospital, they're treated immediately as part of Medicare. But Angela isn't enrolled in traditional Medicare. Like more than 8 million other seniors, she opted for an alternative program called Medicare Advantage, run by insurance companies. David Rosen is Jamaica Hospital's CEO. He says the program is shortchanging seniors, like Angela.
We see frequent evidence of denial of care that would have been a no-brainer under the conventional Medicare program.
And government audits show the problems are widespread. Backlogs of patient complaints, improperly denied claims, and unethical marketing practices. In Angela's case, Oxford denied a series of requests by Jamaica's staff, including rehabilitation in the hospital. Doctors said it was Angela's best chance to walk again, but Oxford said inpatient rehab was not medically necessary. Unusual thing to request in a situation like this, rehabilitation?
Of course not. We had basically begged them, give us a week. Try her for a week. If she doesn't work for a week, then what are you going to do? You're not going to pay us anyway. We're going to be in the same boat we're in right now. Just try her for a week. No.
Surprised by what the HMO said?
Stunned.
Critics like Rosen say denying care for Medicare Advantage patients isn't good medicine, but it is good business for insurance companies.
They're making a lot of money.
Last year, Oxford's parent company, United Healthcare, made more than $4 billion. Some of that profit came from you, because Oxford and other companies are paid by Washington to run Medicare Advantage, even though government reports show it can cost as much as 20% more than the traditional program. Despite the higher price tag, critics say for some patients it's hard to see the advantage. In Angela's case, rather than keeping her in the hospital for rehab, Oxford sent her home in the back of an ambulance.
And she said, well, I guess I'm just going to stay in my bed then and die.
A week later, she was back at Jamaica Hospital with bed sores. That's when we met Angela. What would you say to the insurance company?
How dare you do these things to me? I was paying every year. I never failed to pay. That's why they took me in.
And now you just want to get
out
back,
of here.
Get up and get home.
Yes,
But on your own 2 feet.
exactly.
We asked Oxford United Healthcare to sit down with us on camera, but the company declined. And like many other times when we've tried to get answers, we were directed to the insurance industry's trade group and its spokesperson, Susan Pisano.
One thing you get if you join a Medicare Advantage plan is better benefits. You get broader benefits. You get lower out-of-pocket costs.
But while seniors may get broader benefits, here's the trade-off. Medicare Advantage plans decide what care they get. You know you have these protracted discussions about whether or not somebody even gets into the hospital.
It's not just a question of money.
What is it?
People should be admitted to a hospital when they need to be admitted to a hospital. But
Yes.
if they shouldn't be there, then a hospital brings risks with it that you shouldn't have to confront unnecessarily.
You think that happens a lot, that somebody goes to the hospital and doesn't really need to be there?
Okay, can I ask you, are we talking about a particular patient now?
No, literally,
Okay.
I could be talking about hundreds of patients.
All right.
The insurance companies will not talk to me about the specific cases. How are you supposed to get answers?
Well, I think that culturally, it's not something that companies are attuned to. Talking about specific, private patient issues publicly.
When they're bad. When they're good, they'll talk to you about them all day long. Like Joe Cameron, a favorite example for the industry.
Yeah, they're doing okay, aren't they?
While Oxford United Healthcare wouldn't talk to us, it did point us to this former Texas insurance salesman. Cameron says he survived a massive heart attack in 2002 thanks to United Healthcare's Medicare Advantage Plan, which paid for a quadruple bypass and several months of rehab.
My bill was $1,300,000. My copay was $1,700. That's an excellent coverage plan.
What United Healthcare didn't tell us is Cameron has been flying around the country to lobby in favor of the program. And Cameron says the insurance companies paid his travel expenses, including United Healthcare, the same company that sent Angela Dispenza a denial of coverage letter while she was still lying in Jamaica Hospital.
Your name, your identification number.
Now, that letter said Angela could appeal the decision. So with her permission, GMA did just that. And a month later, we got a response. The letter didn't say if Oxford was wrong to deny Angela's care or even who would pay her bills, but it did say that the issue was not for Angela, that it was between Oxford and Jamaica Hospital. Lucky for Angela, Jamaica Hospital gave her inpatient rehab, providing the same treatment Oxford called not medically necessary. And look at her now. Angela is back on her feet, walking, and she can't wait to go home.
I'll be dancing.
She will be dancing, and she's beautiful. Again, Angela was lucky here because she got the rehabilitation, and the insurance company said she won't be billed for it. But Jamaica Hospital says it still hasn't been paid by Oxford and doesn't think it will be. In fact, the hospital's parent company is suing Oxford in federal court over issues just like this one. Okay, we talk to a lot of experts who say patients aren't as lucky as Angela very often, that they get turned away by the hospital, and that this is something people have to think about.
Let's point out what the difference is in Angela's case. That letterhead from ABC News.
Maybe. This hospital, to be frank, Jamaica Hospital is lobbying very actively on her behalf. But
so it could be partly that, too.
It could. But we like to get involved in these things because you see someone like Angela, and it takes your heart, and it hurts it because
but
you
want to
wonder
how many other patients out there could use a letter from someone like you to go after the system.
That's exactly right. And that's why we do the stories, because the more people know about it, the more we pay attention, the more people there are to help people like Angela. It's time now for the weather. Let's go.